Hi students, I'm wanting to try to get some of the content from Chapter 5 to you through this video, and you'll notice that I'm going to start on page 105 of our textbook. This is the beginning of information about trans crisis, about difficult clients in therapy, a little commentary about borderline personality disorder clients, and some ground rules for coping with difficult clients, and this is all, of course, related to crisis intervention. What you will notice is that I'm not going to be talking about the crisis intervention training that's in our text. And as I look at my book, that starts on page 101. The reason I'm not going to talk about that with you now is that I'm going to have a police officer come to our class and talk about being CIT trained, and but that person can't come until early March, and so I'm going to put off that discussion and would put off that testing too until we get a little bit closer to that time in the classroom, so that we can have a little bit of information about that before that person comes in to see us. So today it's page 105 through the end of the chapter. So looking on my lecture outline, this is item number Roman numeral 4. That's where we'll start if you want to maybe take notes as we're doing this. Maybe you can pause the clip if you want to. So what we're talking about is partly helping clients who are maybe experience a trans crisis event during your helping experience with them. In the textbook, they refer to this and discuss this as being a part of long-term relationship with a client. And so you can think about it that way if you want to. The way that it's presented in the textbook is definitely a trans crisis event that happens to a woman who's been seeing her therapist or helper for quite some time. So the interesting thing about this, and the scary thing really about trans crisis occurring, is that it happens kind of unexpectedly. And as you read this section of the textbook, it addresses a client whose name is Melanie, and you'll see that the crisis worker or the helper has been working with this woman as she left a destructive partnership, a marriage, I think, that was abusive. And so this client, Melanie, has been working on becoming a more independent person, not returning to the abusive relationship. She's basically probably had to rebuild her whole life in terms of deciding how she's going to take care of herself. And it sounds like in the textbook description that she's been pursuing a community college degree, which is great. And then she's now at the point in her life where she's completed her degree and she has a chance to have an application interview. And so this is where the case study picks up, at the point where the client is calling her crisis worker, and she is disturbed and upset, and basically she's in a panic about feeling that she can't, live up to what it is she's been trying to do. So the scenario is that the client is agitated when the client calls, and the crisis worker, or maybe I should say the helper in crisis mode, knows that she has to calm the patient down, and she has to assess also where her client is. If we want to think about using our triage assessment form, that would be a good place to start in terms of trying to evaluate what's happening with the client and how agitated and out of control her client is. This is kind of interesting because this is a client that the helper has known for quite some time, and they've probably had a lot of really productive and peaceful sessions talking. But as the client approaches the crisis worker on the phone, this client is not in control and is actually kind of spinning out of control. The thing that's causing this client to spin out of control is her anxiety. And so, as I've often said in our classes, when we become anxious, we definitely tend to return to other forms of coping that aren't very effective for us. And each one of us does that a little bit differently. Some people become more aggressive and abusive. Some people become more dependent. Some people want to cope by using a substance and just sort of opt out of the coping. Some people may choose to reach out. They may try to talk to a family member, or they may try to call a friend. They may even turn to some reading that they know. They may pray. I mean, there are lots of ways that we respond in a situation that's anxiety producing for us. Well, the client, Melanie, in this circumstance, really resorts back to an old pattern of behavior for her, which is to become dependent and to think about not having to face this difficulty. And so that's where this story opens, with this client, Melanie, and her crisis worker. So you might want to turn off the clip and just read this section, or reread this section where Melanie and her therapist are working together, and it shows their pattern of communicating with each other. And if not, we can just continue talking about it right now. But where I'm going to start is on our lecture outline call. It's called Handling the Client Who Has Trans-Crisis During Therapy. So, as an intro, again, I would say that when a client is in a regular helping relationship and something happens that causes their anxiety to go up, we're probably going to see several possibilities of behaviors. One of those is the first one that's discussed, and that is that a client can have an anxiety reaction. And as you read about Melanie, you see that that's happening for her. She's becoming increasingly anxious and agitated. She can't sleep. She has practiced her job interview. She has been prepared carefully by her therapist, and probably left her last session with the therapist feeling very much like she was ready to go. But her anxiousness starts to creep in, and before it's over, she can't sleep, she can't concentrate, she feels completely in a panic because the next morning she has to go and have her interview. And so the anxiety reaction that this client is experiencing is becoming more and more debilitating. And the thing about it is that as it becomes more debilitating, she is more apt to want to react in a way that is a pattern for her, which is to become dependent. So I don't think it's a dependent move for her to call her therapist for some support and calming and so on. But the scary part of her perhaps acting in a dependent way is that she's also considering, oh, phooey, maybe I should just go back to that relationship. You know, that relationship had some problems, but at least, you know, I knew how to react, and I didn't have to face these really overly demanding kinds of things like going to a job interview. So that's the really dangerous part of it, and that's really where, in my view, her therapist needs to try to calm her so that that returning to the abusive relationship isn't part of a coping pattern that she wants to take on. So she's having an anxiety reaction, and the counselor, just from talking to her, can probably hear it through the various kinds of statements that she makes. She's agitated, and I'm looking down at my book on page 106. She calls, you know, at a very unusual time in the middle of the night, and she's saying, I'm so scared. That's the first thing that she says. But as you continue to read through, you know, maybe her first statement to her therapist and the second one too, you can start to get the picture that this is not an aggressive client. This is not a berating kind of client. This is a client who's scared and anxious. So she has this anxiety reaction, and what the therapist does is to help the client with a grounding kind of exercise, which is to sit down and to take some deep breaths. And actually, I'm not sure if she asked her to sit down, but she does say, let's stop for a moment, and will you just take some deep breaths with me? This kind of thing, this sort of stopping the free-flowing anxiety and doing it in a pretty directive way is sort of an anchor for the client. It's almost like you become a grounding person or a grounding force for the client until they can ground themselves. So when I say grounding, I mean getting away from free-floating anxiety and fear or panic even, and just I'm putting my feet on the ground even as I'm talking to you, because it makes me feel like having our feet on the ground makes us feel planted. And even sitting in a chair or leaning against a wall would make me feel kind of grounded and supported. So that's what the therapist asked her to do initially in this responding to an anxiety reaction, is to have the client take a couple of deep breaths. You could use other kinds of directive statements, such as, I want you to find a comfortable place to sit, or slide down against the wall and just sit and talk to me. You might ask the client to look around the room if they really start to sound like they're losing touch with what's going on and escalating. You can ask the client to tell you what they see. You can ask the client, what are you wearing? What kind of shoes do you have on? Anything that kind of directs the client's attention to something that's in reality. And so again, I just want to say that this can be a helpful sort of set of responses to ask a client to give when they're emitting anxiety. Also in my notes I have that the client may use one or another type of flight behavior. So certainly escalating up into anxiety is maybe the first expression of our flight behavior. That's kind of interesting to think about, isn't it? We often talk about fight or flight behavior when a person encounters a scary situation. So clients who have trauma in their background may first have an anxiety kind of reaction. They also are a tendency to maybe be making good progress, but then all of a sudden you hit a bump in the road. And these are evidences for how you might know that the client that you're dealing with is having an anxiety reaction. Excuse me. So I think I've talked to you about the de-escalation of this client. In my notes I have it written as de-escalating rather than grounding. But again, just to reiterate that, the helper is asking the client to use deep breathing techniques for a couple of minutes. Even a minute of asking the client to take some deep breaths with you is a long time when you're sitting with a client and you're just breathing together, either in person or over the phone. Also, you can, the other thing that her therapist does with her is that it says in the book that she reviews the whole role play that they did about the job interview. And so the therapist is taking this client out of free-floating cognitive state and anxious behavior into a very specific and directed kind of activity that involves her mind. So now the client is being asked to replicate the role-playing that they had done earlier in the day of the job interview. And so again, here's another way to use the client's mind to direct them to something that requires their psychic energy, really. They can't keep having the psychic energy out and free-flowing everywhere. So I think that really makes sense when you think about it. I would add at this point that often it's very helpful when a client's having an anxiety reaction to be more directive, to make statements like, I need for you to sit down. I want you to stay on the phone with me. I want you to sit up in your chair and take some deep breaths with me right now. Let's do that. So, I want to be sure to not make this sound as if you're bossing the client around or ordering the client around. It's softer than that. It's using an I statement. I need for you to. I want you to. It would help me to help you if you would do this for me. And that sounds it sounds more collaborative and less sort of bossy, if you will. Let's see. Another thing that I have on the lecture outline, point B, is that the client may regress. And a lot of times when I talk with you about regression, I'm talking about the client returning to very much younger behavior or less mature behavior. And let's continue our thinking about this topic as we look at the client Melanie. And if you read, let's see, where is it? I think it's on the bottom of page 106. Melanie starts to, be sort of talking in a more childlike voice, saying, I know what you're going to say. I know you're going to tell me that I have to do this, or you might be disappointed in me. But anyway, the client might start to act a little less mature than, adult to adult. And so this regression is another thing that can happen as a client is perhaps going to have some problems that might lead to a trans crisis event. So it's a reaction to the anxiety. Not every client will do this, but many, many human beings do sort of regress to earlier functioning levels when they're faced with anxiousness. And I think I've talked with you about that in class before. And the reason that she's probably doing this is because, again, it is familiar. It is more familiar for her to be a dependent person. And often, not always, but often people who are living in an abusive relationship have some aspect of them that is quite dependent. And so it's logical that as this client, Melanie, begins to escalate in anxiety and her therapist starts to challenge her to become, return to a more mature way of behaving, she kind of defaults back into this dependent behavior until the therapist, basically is very direct with her and says, well, it sounds like what you're talking about doing is just moving back, and that would be easier, and then you wouldn't have to go on the job interview at all tomorrow. You could just go back to this other way of life. And she's kind of, in a way, confrontive to this client and letting the client hear those words and think about what it is that she is actually proposing to do. So one of the helpful things to do when a client starts to become more regressive is to recognize that this is a sign that they are also experiencing the stress level is pretty high, and to not belittle or berate the client, but to propose to the client that you're seeing this kind of behavior, and is this what the client really wants to do, and that you would feel that the client is, going backwards. To be frank. Let's see, another piece I want to talk with you about is the client who might re-experience a trauma within a session with you. And this is the example that is used in the book for trans crisis with this client Melanie. And it happens very suddenly. It's very weird and unpredictable. The therapist might have wondered if this client had experienced some kind of early life trauma, but if Melanie never brought it up, and even if Melanie, it's not in her consciousness, then she may not even know herself or remember herself that she experienced something. But all of a sudden, the therapist says to Melanie something like, I wonder if maybe the reason that you are acting this way is because of something that happened to you a long time ago when you were younger. And then, boom, for some reason, Melanie she kind of flips into this conscious remembrance of a traumatic event. And it is very shocking for the client. It's very shocking for the therapist, because all of a sudden they were talking about one thing, and wow, they're in a whole different place right now. And you can imagine, this is over the phone, by the way, you can imagine that the therapist realizes, oh my gosh, this person could really, really escalate even further than she was when she first called me. So now, where it's kind of interesting to think about this in terms of client escalation and the triage assessment form, if the therapist, thought about triage assessment as that client left her office that day, she might have rated the client's affect and behavior and cognitions as well within normal limits. But then the 1 o'clock in the morning phone call comes, and if the therapist thinks to try to assess the client, in a triage assessment form kind of paradigm, she would definitely put the client's scores more in the middle range of disturbance. Well, then, just to review this, they go through this grounding exercise and some deep breathing and some talking, and the client is actually kind of de-escalated again. And just unfortunately, the therapist says something that is just somehow the exact trigger that's going to bring this unconscious remembering, this unconscious event into Melanie's consciousness. And then she is really, really starting to get almost vibrating with anxiety. And you can understand why. If this was the first time a client remembered something like this, the client would very much be demonstrating more anxious responses. You might hear the voice tone go up. The client might start speaking more quickly, or the client may just stop kind of emitting sounds and sort of move towards that immobile, disassociating state. Also, the client herself may experience shaking uncontrollably. The client, in this case it's a female, may start to cry and wail even. I mean, you can kind of think about the sort of the level of emotionality that could happen in a situation like this. So again, just to sort of go back from the beginning of, this phone call, it's sort of gone up and down, and now it's getting ready to go way up because of the trans crisis event being remembered by the client. So this is a scary thing. It's scary for the client particularly, but also really scary for you as a crisis worker, because all of a sudden, you're kind of in, Virginia, and just that quick you've moved to a whole different state. And it requires us to stay calm, and it requires us to become more directive. It requires us to think about what it is will help the client settle down. It requires us to not lose our own sense of effectiveness. Excuse me. One thing I have in my notes about this, as a client might move into a trans crisis state during some kind of helping experience you're doing in crisis, is that we've talked about cathartic emotion, that the release of high anxiety, maybe rage, sometimes sadness, sometimes a bereavement. It could be any kind of, high level emotion. That cathartic effect of releasing that emotion can be very, very helpful to a client in sort of discharging all of that pent up stuff. But what happens in trans crisis, or what the potential is that the client can move beyond cathartic and move into a state of severe disequilibrium. So I'm going to say that again. In a trans crisis moment, the client can be looking like, sounding like they're having a cathartic experience. And while that can sometimes be a little bit unnerving to us, we can use our minds to say to ourselves, let me stay here with the client, let me remain calm. I'm not going to flip out because my client's flipping out. I need to be the person who is, kind of more in charge here, or more in charge of my emotions. But then a client, starts to maybe disassociate or become immobile in some other way that really lets us know the client has escalated from maybe, 4 to 10. And that is a scary moment. So I think it's great that they bring this up because it can happen. And also I think it's important for us to reassure ourselves that some of the most effective crisis intervention that gets done is done by volunteers on crisis hotlines all over the country and really all over the world. And so those people aren't people with, really extensive advanced training